Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning and welcome to Open Your Eyes.
Start your morning right. I am John Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
Yep, a beautiful Wednesday morning for those of you who are waking up thinking that it's a Tuesday. No, you had holiday Monday. It's actually a beautiful Wednesday morning here in the city. It's lovely.
Gosh, at first I thought it's raining. It must be raining, but it's just the breeze that's popping, man.
Yeah.
You know, I guess if you're thinking of skipping a day of work, you know, this is a great day to be outdoors. Or if you have time off, that's what I should really say.
If you have time off, this will be a nice day.
Spend it outdoors.
But besides that, Mar, I mean, like, you wake up, make sure that you wake up very early, especially for those of us who would go out there and do some walking or some running or some riding. This is a great day for that. Oh, well, not for the cyclists, because trust me. You're
they get a better workout.
They get a better workout indeed, but it's so wonderful out in Belize City. And you know what? We do hope that it's the same in your neck of the woods. A little later on in our introduction, of course, we'll be chit-chatting with the folks there at the National Met Service to let you know exactly what to expect throughout the day.
That is right. You know, I do think that after all that we ate over the weekend, it's a good idea to step outside and eat a bit. I see the guilt written all over your face.
Well, anyway, with a capital G, you know. I mean, seriously, Christmas was. I give a lot of kudos to us Belizeans, whereby we went out and we shopped, and we shopped and we shopped and we shopped. Even in Christmas Day, people were out there doing some shopping at different places that were open. The day afterwards, you saw people out there as well. So we know that, you know, spending our money locally right here at home, we know that it's a boost to our economy, and I'm so glad for that. But as per usual, Marlene, spending money always comes with a little bit of trouble, which leads me to talk about what we're seeing in the newscast. There were a few murders over the weekend, over the Christmas holidays. We'll be chatting about those a little later on. But primarily, Mar, the impasse with the Belize sugar industry and, of course, the Belize Cane Farmers Association, it's turning into an ugly situation there.
Yeah. So as of the end of day yesterday, we know that there were some blockades being put near the mill, and it is a very concerning situation. I think we've said it many times before, and for people who don't entirely remember why there's always great concern when there are protests that arise in the north in this industry, is that it can get very heated. Let's remember one thing, you know, I can't give you the exact numbers, but there's so many families in the north that are reliant on this industry as their main source of income. And so when you consider the fact that people are thinking of their livelihoods, about what they're going to make, it becomes a very tricky situation. And it's not necessarily like working for an employer. You know, you're the one who goes through all the work as the farmers, who prepare the crop, and then your last step is getting to the mill. Now, as far as we understand it, up to the end of day yesterday, the main issue seems to be that the agreement was made for an interim agreement. One of the associations, there are several, is saying that they want the interim agreement, the temporary agreement, to last until August while 1st, the millers want to have it until April. The crux of the matter here is that in the meeting that was held to kind of broker a deal along with government and government bodies, they did agree on April, but now the association is saying August is in fact better. So it's and when we start to see, we'll of course give you an update on that as soon as we know how things panned out this morning. But you know, John, it could be that they had a good rest and cooler heads prevailed. And this morning, things hopefully can be settled as quickly as possible and without incident.
Let's hope, and that's a big hope there, because we know how it is when it comes to the sugar industry. And you're totally right, Marlene. You know what, I'd go as far as to say, you know what, all families, especially up north, they rely heavily on the sugar industry of our country. But in using the word hope, I could, or we could actually go back to 2009, where somebody lost their life, actually, as a result of, you know, an impasse up there again. And we're hoping that this time around, that will not be the case. We've seen the scuffles that went on up there. I think it was on Monday or Tuesday. It was Monday, and of course, it's something that we actually ran in the news as well. But what will it take for things to be as smooth as it is supposed to be? If you have one body saying something, another body saying something, they're not coming together as one to try and make things happen, then of course things might get a little bit heated. I really, you know, and I thought about this morning, and I said, Orange Walk or that particular area is known for, we will eventually fight for what we want because that's how we feel. But I'm hoping that, Marlene, cooler heads will eventually prevail. They'll eventually put this thing on the table and say, hey, let's move on with what we've got. This could lead to, you know, a crash in the industry, something that we don't want, something that we actually don't need. We need these things in our country.
And, you know, that's one of the issues. The scuffle that you spoke of yesterday was about persons who were saying they were no longer on the list associated with another association. And that, of course, led to a physical altercation that was captured on camera, which we reported on yesterday. So things, I think when you put that into perspective, you see the blockade, you see the shifting in position, the 1 week delay. It's safe to say that things are a bit heated and tense at the moment. The fact that they were able to broker an agreement right before Christmas was something that made us feel we could start off optimistic about the start of the season.
The season, yeah.
But yeah, the blockades yesterday was a bit concerning, and we keep referencing the shooting death of Atanasio Gutierrez. I remember that so vividly. That was, of course, in the midst of a protest where a bullet had caught him, and it was a very tragic moment. But we've also seen other flare-ups. You know, there've been blocking of bridges. There've been other protests that didn't escalate to that point, but were also, you know, I think in looking at it, it also can get very, very tense and very heated.
Indeed, indeed. We do hope that things could eventually cool down, like you mentioned. We do hope that, you know, from last night's rest, there'll be cooler heads to prevail, and we will eventually move forward for the best interest of all parties involved with this situation. Of course, we'll be keeping an eye on that as we pass these stories to you at 6 o'clock in the evenings, right here live on 5. And moving on, Mar, one of the things that I'm noticing, I know you referenced the story earlier, but primarily for me, what I've been noticing is the few days of the rise of new cases of coronavirus that's surpassing now the recoveries, something that we hope would not have happened, especially not this early. We know that there is a new variant out, which is the Omicron variant. We're not sure if it is in the country at this particular point, but we will definitely be speaking with the professionals to let us know what the current situation is. The Christmas season will eventually showcase what these numbers can be, because everybody was everywhere at every time during the Christmas season. There we go. And this was between December 20, let me see, I think it was from Tuesday to Wednesday. Was that Tuesday to Wednesday? No,
no.
Over the weekend too.
This is the weekend numbers, yeah.
So the weekend numbers are, from the 25th to the 28th.
So it was the last report we got was on Friday, and this is Tuesday's report.
So there we go with the confirmed cases. Yeah.
So it's 3 days worth of cases. But, you know, I'll go out on a limb.
Okay.
And I'll say this much. I think we're fooling ourselves if we don't believe that Omicron variant isn't already here.
You feel so?
I know that in just conversations, I am hearing of far more people testing positive just within the past week. And it is what we are seeing as a trend across the globe. The Omicron variant is the dominant variant now in the United States. We're in the thick of our high season. We have seen travelers come in. We know that the vaccinations, while they're helpful at this time with Omicron variant in reducing the level of severity that people are facing with Omicron, it isn't stopping them from contracting
it,
or
yeah.
spreading this particular variant. And so, and we don't even have to say tourists too. We have people who are Belizeans who are
Belizeans who
traveling,
actually, yeah.
who are going to visit family, going to the United States and coming back as well. And COVID is just one of those diseases. We've seen some of the most careful people that we know still contract it.
Yeah.
It is just one of, it's a disease that can sneak right in when you least expect it. So I think that we're probably going to continue to see more cases as the days go by, especially as you said, because we know that there's a lot of gathering that took place.
A lot.
Not over the weekend, but also in the frenzy of shopping that took place leading up to that.
Indeed. Frenzy of shopping. You said it right. And as you said that, I was like, oof, that's true. Because everybody, like we mentioned, patronizing Belizean businesses that was actually happening throughout the Christmas season. And so therefore, these numbers, we're not sure as to what they'll be. But I'll join you out on that limb and say, why would we want to fool ourselves to not think that the possibility of Omicron not being in our country is not, you know, there is definitely a big possibility, which of course is going to be one of our conversations this morning.
Well, not about confirming, but you know, I think that's one of the things that we're still waiting to hear what the Ministry of Health is going to say. We are told that the gene sequencing test is being done in country, and it is, you know, one of the things that we are lucky to be able to have the technology and now the skill sets to be able to execute this type of testing. So there should be some level of surveillance taking place. We're yet to get a report as to whether or not any cases have been detected. But yeah, you know, even when the variant was first named a variant of concern, by the time it was detected, it was just a few weeks before it became the most dominant variant.
Yeah.
And you know, I think we can all speculate as to how that happened. One, because it's considered so highly transmissible.
Highly transmissible.
But
Yes.
also because it could have been circulating before it was noticed. So you know, I just feel that from what we've seen with past variants, from what we've seen with the spread of COVID, it's safe to assume, and even more so, it's safe to move around with the anticipation that there is this highly transmissible variant out there. And so we have to take every precaution we've been asked to take, but to be vigilant about it.
Indeed. What's going to be the next move from GOB, and how are we going to contain the coronavirus in a whole? So I think one of the things we need to continue to do is to keep our distance, hopefully, wash your hands, wear your mask, and try to live peacefully, you know. And I think that would be one of the ways we could eventually try to get things down. We have been doing great with respect to you know, cases going down, and now we could actually see a trend starting to happen again. But that's definitely.
And it's so difficult because when you think of it, and I guess it's almost human nature. We see cases go down, we see things start to calm down, we think,
rush
it's
out.
safe to go back out. You know, there's some of us that when we see cases go up, we clamp down on activities that we would normally engage in. And then the numbers start to go down and you say, okay, well, let me get back out there, let me go and do all the things that I wasn't doing before. And then we see a spike. So it's really a tough situation when you constantly monitor, because those dips often are followed by a spike.
Definitely. And I throw this in because for those of us who know that, okay, we've been vaccinated, and of course we've received the booster already, we tend to disregard it even more, you know. And I'm guilty. I'll tell you that much. Guilty of saying, you know what, I've been boosted already, and so therefore the possibilities of contracting is very, very, very far away. That's not true. All right, that is not true. You're still able to contract the virus. You're still able to transmit the virus. So let's continue to be very vigilant as we're in some tough times here.
All right. And with that, let's get moving into our show for today. And we're going to start off with some motivation to get you going. That means it's time for Eye Opener. And our Eye Opener, taken from dailyom.com, goes like this. Remembering to say thank you to our guides is important for the completion of the help they have given. We may have become accustomed to asking for help from the unseen world, whether from angels, guides, or ancestral spirits. But sometimes we may forget to close our connection afterwards with a thank you. When we connect to these energies for assistance, it is much like a phone connection. Forgetting to close the conversation with a proper goodbye is like not hanging up. While that line is still connected, others can have trouble getting through, while in the meantime, batteries are being drained. Saying thank you is a way of releasing our concerns into trusted hands and getting out of the way so that the universe's divine order can work on our behalf. Beings of light don't require our gratitude. It is an energetic acknowledgement of trust and release that benefits us. When we bring ourselves to a sense of being grateful, we affirm that what we have asked is already done. Then we can move forward with confidence to do the things we are meant to do while knowing that all will be well.
Thank you and grateful, Mar. That to me, that's my, I'd like to say, in words, brain food. Thank you and grateful. Because it's totally right in terms of how it puts it with respect to the telephone situation. It's like you're not hanging up. And so therefore the line is wide open, blocking those who would want to eventually get into you because you haven't said thank you. And when you say thank you, you actually show that that gift of gratitude, that you're so thankful for what had happened. If it was a conversation, if it was just a meditation, saying thank you to the powers that be is a great feel. And for that reason, I feel a great feel of gratitude when I do. If I've got that, I tend to be at peace with myself. If I'm at peace, it's easier for other calls within my mind to actually come in. That's how I feel. Yeah. I love the eye opener.
I went off on a different thought there for a moment. I think when we spend a lot of time praying for something, whether it's to your God, whether you're just, wishing out to the universe, whatever works for you, in those circumstances where you do get it, do you say thank you?
Yes.
And how do you say thank you?
Thank you for me is basically, especially when it comes to prayers or whatnot, it's actually putting myself at a calm or accepting that I feel at rest or at peace with what I feel. That's how I say thank you. Thus bringing new lines or creating new lines open for me to have another conversation mentally or to that I give praise and thanks to. You see me? I love
praise
it.
And I love it. Yeah, no, absolutely.
I love it. I love it.
But a really great reminder for us.
Indeed. And I think it's a great way to start your conversation this morning by saying thank you and, of course, having gratitude for what you've got. This was good. Well, it is a time of the morning. We move on to let you know exactly what the weather is going to be like. We'll be joining the forecasters there at the National Met Service to let you know what to expect for today. Do we have those folks on there yet?
Yes, we do. We got Derek Redun who's joining us. Good morning.
Mr. Redun, good morning.
Good morning.
How are you today?
I'm doing good, thank you. And how are you all doing?
Song like you're never sure, but it's all right. But let's get on into it. We know that this morning gusty winds were actually felt that. We felt that yesterday. We felt that again today. Will that be the case throughout the day? Let's start with the general situation. What should we expect?
Okay. A dry and gusty southeasterly airflow is prevailing over the area.
All right. And in the 24-hour forecast?
Right. We're expecting mostly sunny skies today. Clear to partly cloudy skies tonight with little or no rainfall, mostly no.
Wow. That sounds good. Now let's jump on into our winds. Where are we feeling those winds from?
Okay, from the east to southeast, at 10 to 20 knots with occasional higher gusts.
Okay.
Sea state, moderate to rough, and a small craft caution is in effect.
Now, while we're getting all these gusty winds, does that mean that we'll be having cooler temperatures? Talk to us about the highs and lows.
Not necessarily. We're expecting highs today of 87 along the coast, which is a little higher than what we got yesterday. We're expecting 87 along the coast, 91 inland, and 79 in the mountain pine ridge.
Okay. And the lows?
The lows tonight, 80 Fahrenheit along the coast, 72 inland, 64 up in the mountains.
All right. And of course, our extended forecast, what should we expect for the next few days?
Tomorrow, similar weather conditions, and that tomorrow is what, Thursday, and for Friday and Saturday also mostly dry weather.
Okay.
All right.
So while we're feeling these gusty winds, though, does that mean that we should be watching out for anything, gusty winds or occasional gusty or locally rough seas?
Yes, and that is why we have this small craft caution for today. So that we expect that to continue tonight. Tomorrow it may ease up a bit, but we'll just have to wait and see tomorrow morning.
Okay.
All right.
Well,
Mr.
thank
Rodon,
you
thank
very
you.
much.
You're
Have a great
welcome.
day.
Okay, same to you.
All right.
All right. So now we know exactly what to expect, Mar.
All right, and we want to say thank you to Derek Redun, and of course that weather forecast was brought to you by UNO.
Cool. All right.
This weather update is brought to you by Uno Belize.
We are waiting for you to jingle all the way with Uno. Get one coupon for every purchase of Belize $25 in Uno fuels, per quart of Uno lubricants, or 2 coupons per gallon. And just like that, you get a chance to win lots and lots of prizes.
The weather there, once again, brought to you actually, by UNO. It's that time of the morning, moving on to tell you exactly what we'll be discussing for this morning. And
That's
the first one
right.
is going to be our COVID update. We'll be joined by a Texas medical physician who will be giving us a regional insight on the COVID variant Omicron. So we're looking forward to that.
Right. So Dr. Varun joined us over a year ago, and this was in the midst of a wave in the United States there, and he was really helpful in helping us understand, especially at a time where no one knew how to treat severe COVID.
Yeah.
And today he's going to help to paint the picture as to what they're seeing in the United States. He is the Chief of Staff and Chief of Critical Services at United Memorial Medical Center in Texas, and he's going to be telling us what they're seeing with Omicron.
All right, so that's the first segment for this morning. In the second segment, it is a miracle story. And it's stories like this we should all give thanks to, because it says that there is hope. You'll be meeting a lady, and of course her caretaker. You'll be shocked to know who her caretaker was while she was battling a sickness, and how a community jumped to her aid to have her up on her feet today. That's going to be our second segment today.
All right, and then we're closing off. Yes, we're excited about New Year's Eve. Yes, everybody wants to see fireworks, but let me tell you something. There are some of our loved ones that are not so excited. And if you are a dog mom or a dog dad, you totally get what we're talking about. So we're going to talk to a member of the Belize Humane Society about how to keep your pets safe.
Yeah.
We know they hate the fireworks. We know they hate the firecrackers, but there are some things you should be concerned about. And they're going to tell us what we can do to keep them safe.
Indeed. So that's going to be our third segment for this morning. We need to take a break though, but just before we do, Mar, we've got our birthday shout out.
Yeah.
And of course, we'd like to say a happy birthday to none other than Justin Veshayim. I hope I got that surname correctly. Justin, here's wishing you all the very best, my brother, to you from the entire family. Of course, from all of us here at Channel 5 and all of us right here on Open Your Eyes. We're going to take the break. When we come back, we'll be diving into our first conversation. Stay with us. We'll be back.
We have been a partner with Smart for over 10 plus years. We have a full Smart plan we use as our major driver for our business. We have a service that rolls over in that if you call one, and it is busy, it rolls over to the next line. So once you call us, you can get us at any time. Before we got this smart service, we were paying upwards of nearly $2,000 in phone bills. Since we've had our smart service, we pay an average of about $600. So we've had tremendous saving, more than 50%. For the businesses, if you want to save money, switch to smart because it is far more cost effective and the service is excellent.
Smart continues to be innovative in bringing new technology and meaningful savings during these challenging times to businesses across Belize. Sign up for our VoIP technology or broadband packages and save more.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
Jingle all the way! This holidays, get one coupon for every purchase of 25 Belize dollars in Una Fuels, per quart of Una lubricants, or 2 coupons per gallon. Jingle all the way with Uno, a brand committed with the future.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Welcome back to Open Your Eyes, and we're moving now into our first segment for today. Of course, this is our COVID update courtesy Fulltech Systems. Now with this segment, we're actually on Zoom, via Zoom, medical doctor, Dr. Jose Varon, who is the Chief of Staff and Chief of Critical Services at United Memorial Medical Center in Texas. We'll be talking about this Omicron virus and what it is and how it actually came to light. Now, in with us is Dr. Jose Varon. Senor, good morning and welcome.
Good morning. Thank you for the invite.
Yeah.
All right. It's always nice to have you. I think this is his second time with us.
That's right.
Your second time with us?
Yes, sir.
All right, nice to see you again. But let's jump on into this. Omicron. We've been hearing so much about all sorts of variants since the start of the pandemic. It comes across as something very scary because we don't know how to fight it off or what to do or what the effects is going to be or are going to be. Tell us about Omicron. How did that come around?
First of all, you need to understand that there are a variety of different variants that are part of this coronavirus. The World Health Organization recognizes 3,916 variants of interest. You're familiar with Delta, you're familiar with Lambda, and you're familiar now with Omicron, but there are a lot of them. And what happens is that the virus tends to mutate. That means it tends to change its genetic content so that it becomes either more powerful or can adapt itself to what's going on. So a month and a half ago or so, this variant was first recognized in South Africa. And what we found was that, if you remember, the virus has these little spikes. And in that spike, that particular variant had 34 different changes in the genetic code. What that did is it made it extremely contagious. And by telling you extremely contagious, I am talking specifically about a virus that is at least 70 times more contagious than Delta. That means extremely contagious. Now, that's the bad news. The good news is that it's not as lethal as Delta. So the way I look at it, this is a virus that is going to get to you guys. There is no question about it. You guys are behind us just a little bit. But just to give you an idea, yesterday in the United States, more than 500,000 new cases of COVID were detected. More than 500,000. That's a huge number. And what that tells you is that this is just spreading like a wildfire. And from my standpoint, there are two kinds of people in this world, you know, those who have Omicron and those of us who are going to get Omicron, no matter what. And that may be good news. And I said maybe good news because that may give us that herd immunity that everybody's looking for. Because it seems that, you get sick with this Omicron and within 3 to 5 days, you get better.
Wow. So let's talk about what you have been seeing so far. I mean, it's amazing to have this conversation now. I know the last time we spoke, it was in the thick of, it was in a time where we knew so little about COVID, and you were really on the front line in trying to determine treatments that would work in treating severe COVID. And now we're facing a variant where all indicators seem to point that the majority of the persons who get it will have a mild reaction to it. But the concern, I know, for us locally is about having too many people that we strain the healthcare system. One that I know has been discussed in the United States as well. Is that what is happening?
Well, we, like you correctly mentioned, we've learned a hell of a lot over the last 2 years. I mean, probably not the nice way, but we learned. We learned what works. We learned what doesn't work. We learned how the behavior of this virus is. And yes, every time we think we know a lot about the virus, then, a new variant comes out or things like that. But what we have learned, especially about Omicron, is that even its presentation is different. For example, when you were talking about Delta or Alpha or Lambda, most people would have severe shaking chills. I mean, they would come into the hospital really, really sick. Whereas the Omicron people come in, most of them tell me, I have a nasty headache, I have a sore throat, I feel congested. They don't lose their smell, they don't lose their taste, the vast majority of them. So it's a very kind of, I'm going to call it mild without undermining how contagious this illness is.
Yeah. And when you say contagious, originally with Alpha, you were looking at some of the markers like, I think it was 20 minutes and whether or not you had on a mask. These were some of the markers that you used to gauge your level of exposure. With Delta, that was cut down. With Omicron, what are the risks?
Yeah, the Omicron, I mean, you literally can be next to somebody and they don't even need to sneeze hard to get contagious. I mean, it is that contagious, and it is to me, it's amazing how rapidly it has spread. A few weeks ago, we have been testing, as you remember from our last conversation, we do testing, and we have tested close to 1 million people in our hospital system. And over the last 3 to 4 days, our positivity index is for every 3 people, 1 or 2 are infected.
Wow.
Every 3 people that come to get tested, and most of them have no symptoms. So it just tells you it's spreading like a wildfire.
Yeah.
Doc, you did mention though that you contracted today, and then 3 to 5 days. Omicron we're talking about here. 3 to 5 days, and you seem to be better. Is that the case? And because primarily or previously, you used to be able to have to stay in for about 10 days.
Yeah, no question about it. I mean, and to what extent that has made a difference, that the Centers for Disease Control and Prevention just came out with a new set of guidelines that actually cut down the number of days that you have to be quarantined, because they're seeing that so many people are getting sick that they're saying, well, it really doesn't make too much sense to keep people not working. So what they're now saying is that you just need to quarantine for 5 days instead of the 10 days that we have been doing now and 14 days that we used to do before. So all of that has been reduced because Omicron seems to be a little more limited than the other ones. Now, the problem that you have, and this is a serious problem, is that if you get, I hope that none of you guys get it, but if you guys were to get it, you don't know if you have Omicron, you don't know if you have Delta.
Yeah.
So you get scared, you either call your doctor or you go to the emergency department. And when you go to the emergency department, because you don't know which one you have, you're gonna start overwhelming the healthcare system. You're gonna fill up those emergency rooms with people that have fever, little chills, a little headache, that may just have Omicron. And then what's going to happen is that those people that truly need to go to the emergency department, the strokes, the heart attacks, they're going to become collateral damage because the system is going to be completely overwhelmed. That's my concern.
Yeah.
The hospital admissions have not gone up that bad. I mean, I have probably doubled or tripled my hospital number of COVID cases in the last 2 weeks, but it's not as bad as the last time we had this conversation.
Yeah, where your entire hospital was filled with COVID patients. I recall that well. All right, what's the difference you're seeing with Alpha? What was the symptoms that you saw with severe cases that were hospitalized compared to Delta, compared to Omicron now?
What we did, I mean, Alpha and Delta were similar in the sense that people were coming in with high fevers, muscle aches. They literally told you that they felt like somebody had beat them up with a baseball bat. I mean, that's what they were telling you. Many of them, especially the ones with Delta, started to have issues that were related to shortness of breath. As you know, many of them ended up in hospitals, and many of them ended up on respirators. People were very, very sick.
Yeah.
The mortality rates for Delta across the United States at some point in time were 23 to 25%. I mean, we were lucky enough that in our hospital, the way we were treating our patients, we were much lower than that, but it was a scary situation. If you came to the hospital and you ended up getting admitted and you ended up in the ICU, I mean, you have 1 in 4 chances of not leaving the hospital alive.
Now let's talk about how the...
But what about Omicron? What are you seeing? I know with Delta there was a rapid progression to COVID pneumonia and double pneumonia in some cases. Are we seeing the same with Omicron?
Well, I mean, there have been some cases, and there has been a case in the United Kingdom. There have been a couple of cases here in the United States. There is a case in Israel that was just reported yesterday of people that went with Omicron and behaved like if it was Delta. But again, those are a handful of cases as compared to every patient that we were having before, that were extremely ill.
Yeah.
Now let's talk about how with respect to vaccines and how they're holding up with Omicron. There are a lot of people who are still skeptical of taking the vaccines. There are people who have gotten one dose to both doses and boosters. How is that holding up with respect to dealing with Omicron?
Well, I mean, the data is clear. The data is that if you are vaccinated and boosted, the chances that Omicron is going to do any major damage to you are very low, actually non-existent. None of the patients that have been reported to get in trouble with Omicron were patients that were vaccinated. So clearly it helps you, it prevents you from developing severe illness. Yeah. And for that reason, we continue to recommend that people get vaccinated. We understand that vaccines are not perfect. We understand that vaccines, have some issues. However, at the present time, and as a mode of stopping this madness once for all, vaccines are one of our best options.
Yeah. So it's been detected that persons who've had booster shots and persons who've had 2 shots of vaccination do still get Omicron. But what you're saying is it tends to be milder.
Correct. I mean, and that's absolutely right. My own daughter, she had the 3 vaccines, and she got Omicron last week, and literally her symptoms lasted for no more than 2 days.
Yeah. So that's, once again, underscoring the value of getting vaccinated to prevent severe illness. What about our vulnerable populations? There are people out there who have been scared to move around for 2 years because they know their underlying conditions. Should they still be as cautious with Omicron, or even crack down even more on their protective measures?
Well, the problem is that those vulnerable people are, by definition, the ones that can get in trouble. And the ones that have been admitted to hospitals and have gotten in trouble with Omicron have been people that had underlying conditions, mostly people that have morbid obesity and people that have uncontrolled diabetes mellitus. Yeah. So, your patients with diabetes whose sugar is way up in the sky, those people still need to be careful. But just as I told you earlier, I have the feeling that we are all going to get this virus. Therefore, those people who are at risk, they must get vaccinated. They are the ones that truly need to be vaccinated, no matter how mild Omicron is, because in their case, even if it was mild, they can get them in trouble.
What about with children who have not been vaccinated? A clear example for me, I've got a 4-year-old at home, and the vaccines that we've seen here is for children 12 to 17. We're talking, I think, the Pfizer vaccine. So what about how it's affecting the little kids?
Obviously the number of cases that have been seen have increased. Just yesterday in my office, I saw 37 patients with what seemed to be Omicron, and of them, half of them were children. But, children fare quite well. Children, they may not even have symptoms. So it's very unusual that a kid gets significantly ill with Omicron. And if they do so, again, it happens because they have other illnesses. One more time, diabetes, some other immune deficiency that they could have.
Yeah. Now, when you talk about, it's the way Omicron is spreading. What are the chances of a further mutation of this particular variant?
There is no question that that's going to happen. The mutations are just part of what nature does for everything. However, one of the interesting things is that as Omicron is taking over the world, it's also, like I said, a benign or a more benign form of COVID. And what you want it to do is you want it to displace and really displace and become the more predominant variant. Yeah. So that the deltas are very weird, the lambdas are not that common, the alphas are not that common. When you do that, you are building up immunity, you are building up that herd immunity where we all are going to get it. And there are a couple of studies that have shown that Omicron-mediated immunity, what that means, the amount of antibodies that you get after you're getting Omicron, they are as good or even better than when you get Delta. which is interesting because you don't have to get so sick like you were in Delta to get good antibodies. But the jury is out as to how long those antibodies are going to last for and how much protection you will have for other variants in the future.
Yeah, yeah. Now, Doc, it's been, I think, a month and a half since the official naming of Omicron as a variant of concern. What are your thoughts? Do you think it was in the United States before? Because we're still waiting for confirmation here. We're seeing a small increase in number of cases, but with the travel industry and just with what we've seen with past variants, it's only a matter of when we get it in our country.
I mean, to me, that was kind of implicit.
Yeah.
When the government of the United States said we're going to close the planes coming from South Africa to the States effective Monday, and they said that on a Wednesday. I said, oops, that's a little too late because, with international travel, just like you said, I mean, this variant is spread all over the world now. There is nothing that you can do to prevent it. Just, make sure that the healthcare system is well established, but there is nothing in this day and age, there is nothing you can do to prevent a variant from going from one place to another. Not like this, when it's as contagious as this one. I mean, just look at the number of flight cancellations that we've had in the United States because the pilots and stewardess are getting ill.
Yeah.
I mean, just that just answers your
Yeah, the
question.
amount of people that were out sick. There were thousands of cancellations. So,
Correct.
I think you really are bringing a level of optimism to this. I didn't think of it as a possibility for herd immunity.
Yeah.
Our weakness, of course, is on how many people we can actually treat in the midst of one major spike. So if you were to say, I think you've said that 1 to 2 out of every 3 persons you're testing are testing positive. Based on previous hospitalization rates, is it about the same or less? And I know 1 month is a really short time to collect data, but what's your first indicator saying?
Oh, the rate of hospitalization is nothing as compared to what we had before. Nothing. I mean, when you look at the number of people that are positive and the number of people that are being admitted, it's almost nothing. The problem that you are getting is that a lot of the healthcare providers are getting sick.
Wow.
I mean, we have a lot of nurses, just because, this is a community spread. So your nurses, your doctors, your respiratory therapists, people are getting sick. So that's where you can start getting in trouble. I mean, and again, that's one of the other reasons why the Centers for Disease Control and Prevention says, well, if you're a healthcare provider and you have little symptoms, you don't even need to be quarantined, go back to work, because they are concerned that we're going to overwhelm the system.
Yeah. Dr. Varun, how are the safety measures holding up against the variant so far? Masks and social distancing and ventilation and washing hands?
It seems that those measures continue to work. There is a little data that indicates that Omicron may stay in surfaces a little more than Delta did, but again, that's too early to know for sure. But yet, using your mask continues to be a good preventive measure. Now, remember, and as we said last time we discussed, for the mask to work, you need to use your mask, I need to use my mask. So both of us, one of us using it doesn't cut it. It has to be both.
Yeah. And I know there's even talks about using, what type of masks you're using now?
Well, I mean, the ones that are being recommended are either surgical masks or N95 masks. And indeed, N95 seem to be the one that protects you the most. The cloth masks are being discouraged because they truly can spread even through it.
Oh, wow.
And when it comes to distancing, they recommended 3 feet at the start of it, 6 feet thereafter. Would you still recommend the 6 feet or something more?
I mean, to me, trying to get people to do the social distancing is extremely impossible. When you look at the data, there is data that actually when you cough, you can spread the virus up to 25 feet. And that is just, you cannot be telling people stay away from 25 feet. That's why they went to 6 feet, and then the guidelines came down to 3 feet because they thought that's what's not. It's just not doable.
Yeah.
So rather than pushing too much on the social distancing to farther away, I would push more on mask placement, adequate mask placement. I don't know if you've seen people that wear the mask down here.
Yeah,
and
we have those.
The nose is exposing and stuff like that. So I think that education on that is extremely important. And, education also for parents and kids. People ask me all the time, how do I get kids to use their mask? I said, well, first let's teach the parents, because if the parents don't wear their mask at home or when they are outside, how do you expect the kid to use it?
Yeah, absolutely. And what about exposure for children at school? We're about to reopen school in 2 weeks. And, some people are worried about what the children may bring home.
Well, and that's a legitimate concern. And what we've been seeing is here there is a lot of controversy. I mean, schools are opening, and a lot of parents ask me this question. And the fact is that, yes, I mean, there is no way your kids are not going to get infected with a variant such as Omicron if they go to school. They are going to get it. I mean, to me, that's simple. Now, if you were to have your kids well educated as far as mask placement, you probably have a chance that they won't get infected. The problem is, tell me what kid is going to be able to sit in a classroom for 8 hours with a mask on? It's not going to happen. Let's just be realistic. So I think that this is going to be a parent decision. When you look at the data is clear that kids need education in person.
Yeah.
There's been a lot of groups that have really indicated that, the last 2 years have been really bad for the psychological effects on kids.
Yeah.
And a lot of people recommend that in-person education.
Yeah.
My concern is not the kids, like I told you. My concern is grandma that lives with you, especially, in our multicultural households where you have the grandmother living with you, the auntie, the whatever. I mean, maybe the grandmother has diabetes or has some other chronic condition or cancer or stuff like that. The kid goes out to school, the kid comes back infected, may not even know that the kid is infected, and then gives it to grandma. That is the concern that I have.
Yeah.
It's not the kid by itself.
Yeah, yeah. And it's been 2 years. I can't imagine you've been treating patients since 2020, critical care patients at the hospital. What do we know now that we didn't know? We talked to you, I think, early 2020. What do we know now about why this is such a fatal disease for some?
Well, we learned a lot of things. We learned that this is a backstabbing illness. It's an illness that truly one day behaves one way, the next day behaves a different way. We know that this illness produces inflammation, but inflammation not just of your lungs, but inflammation of everywhere. And when we're talking about specifically the bad variants, variants like Delta, I mean, you can have anything. You can have heart attacks, you can have strokes, you can have all sorts of things. Our treatments have changed. Our treatment modalities have changed. We, very early in the course of this illness, developed a series of protocols that actually have shown to decrease mortality rates. And our protocols were aimed specifically at decreasing the inflammation and decreasing clotting, which are the two ways by which the illness kills you. So a variety of different immune enhancers were used. We learned that the use of vitamins was extremely important. And, that goes back to when your grandma used to give you vitamin C when you were sick as a kid. Those things we learned. We learned what doesn't work. We learned that, for example, monoclonal antibodies, we know that the most common one, the Regeneron, doesn't work for Omicron. So it's a waste of money to use it. Well, we learned that, the new antivirals that have been just recently approved by 2 pharmaceutical companies in the United States, they work, but they work only if you use them in the first couple of days of the illness. And the problem is that most of the patients that come to my office, they come in with already a week or 2 weeks of symptoms. So a lot of these therapeutic interventions, at some point in time, remember people were using remdesivir for this, remdesivir for that. And the fact was that remdesivir didn't change mortality. On the contrary, actually made things worse, especially if you didn't give it after the first couple of days of the illness. And as I said, my patients that come to the emergency room, they come in with 2 weeks of symptoms before they show up to the emergency room.
Because usually it's around day 10 that things start to get critical for people, or between 7 to 10 days. So they would have been.
That is correct. But that was probably the most important thing that we learned. We learned that this is an illness that has phases. On the first phase, you have the virus that is actively replicating in your body, is actively multiplying in your body. But at some point in time, that virus dies. And when the virus dies, then what you are dealing with is the ill effects of the virus, all the inflammation, all the clotting and stuff like that. So all the therapies that initially we said, hey, let's give an antiviral. Well, the antiviral works as long as there is active virus in your body, but if there's no active virus, it doesn't help you. And it's not going to take away the problems with the oxygenation, with the clotting, with things like that. So that's why we have to think in a different way. And instead of saying, okay, this is a viral illness, let's give an antiviral, we said, no, it's a viral illness, but we need to deal with the end effects of this condition.
The damage it's caused.
Correct. We've learned a lot. I mean, I truly can tell you, I think we have learned a hell of a lot on this illness. It's not been a fun learning experience. I mean, I've been doing this for the last 651 days, and yes, I am counting them.
Wow. I know, because I also read that you have not taken any time off since the start of this. How are you doing?
Well, I'm exhausted. I took a couple of days off in July to marry my daughter in Cancun, so at least I had the opportunity to take a couple of days. But I was never off. I was always on the phone. So, but my unit has been going on. Today is day 651. I'm exhausted. My staff is exhausted because, every time you think that things are getting better, then you have one of these new surprises or new variants.
I just wanted to throw this out, Doc, that especially when it comes to in being in offices, you hear, or we're here today, and somebody here gets it, and we hear about, okay, that person is positive today. It might be Omicron. Then we run to the medical center to get tested. Would you advise the same when it comes to dealing with Omicron? If I get it today, after how long would I see that, I'm infected?
Well, I mean, if it's Omicron, you probably will know within 2 to 3 days at most. Again, running to get tested, in the US, we have the capability of getting tested at home. So, people buy their home kits and then they just get tested at home. That to me is the easiest way, because unless you are extremely symptomatic, like I told you earlier, I'm trying to avoid overcrowding of emergency departments. Even our testing centers, if you look at them, we have testing centers right now that, they have miles and more miles of lines of cars just waiting to get tested. So, anything that you can do at home is obviously better, unless you are very sick. So what are the reasons to call? First of all, I would tell you, anytime you turn positive, you have to call your healthcare provider. That's for sure. But when do you need to go to the emergency room? When do you need to say, okay, I'm sick enough that I need to seek attention? Well, I would say anytime you have shortness of breath, chest pain, any symptom that doesn't make any sense, like you have an arm that is weak, like if you had a stroke, or, you've developed a rash all over your body. Anything that doesn't make sense. But if you have shortness of breath, if you feel literally like dying, go to the emergency room. But otherwise, I would avoid going to the emergency rooms just because, you think that you are positive.
Yeah. And just, for people, we're still in a cautious phase. We are slowly, it seems, coming out of our Delta wave. So there still is the Delta variant in Belize. And we are, anticipating or assuming that Omicron is on its way or already here. So it still is a cautious time for us. When people test positive, what are some of the things that we now know are helpful for a better prognosis?
Well, again, as a lay person, you don't know one way or the other
Yeah.
what you have, and that's what scares people, and that's what gets people to go to emergency departments and overwhelms the system.
Yeah.
But what we do know is that Omicron will present much milder.
Yeah.
I mean, Omicron, you will know that you are positive. You, like I said, you'll have the congestion, you have the sore throat, but it's not going to be something like beating you up with a baseball bat like in the other variants.
Yeah.
I mean, at least I can tell just by even looking at the patients which one is more likely of the variants. But people need to be careful. And, you need to do whatever you can within your own way to enhance your immune system so that you can fight this infection very easily. What do I mean by enhance your immune system? Well, if you have a chronic condition, make sure that your sugar is controlled or your blood pressure is controlled. I mean, if you are obese, this is a good time to start thinking about going on a diet. You don't have to wait until January 1st. The use of vitamins, vitamin C, vitamin D. We actually have data that shows that if your vitamin D levels in your blood are about 50, you do not get COVID. Obviously, you guys in Belize, you have no problem with that because you have all this beautiful sunlight and things like that.
Yeah.
But people that are not exposed to light, that don't consume vitamin D, they tend to get these variants. I mean, one that you may not be aware of is melatonin. I know that you guys, when you hear melatonin, you think that melatonin is something to go to sleep. Well,
yeah, that's my go-to.
Yeah, I know, but it's interesting because we found that the animal on Earth that has the largest amount of COVID is the bat. Bats have a ton of COVID, but they don't get sick from COVID. And what we have found was that bats have a very high amount of endogenous melatonin. They have their own melatonin that produces it. And there are a lot of studies that have shown that when you are sleeping at night, when you are producing your own melatonin, you are increasing your immune system. So we are actually now using routinely melatonin for patients to improve their immune system. It's not a cure, but at least it gets your defenses better so that you don't get in trouble.
True. And I've heard from people who've had COVID that usually sleeping is a challenge. Anxiety is a big part of it because they're so concerned about getting severely ill. So that's definitely helpful that they need to get their sleep.
And there is no, I'm sure you remember when you've seen your friends that, they couldn't sleep because they were working or they were studying for a test or whatever, and they would get ill.
Yes.
Your immunity decreases because people don't sleep. I don't know how I haven't gotten sick, but because I don't sleep at all.
Knock on wood, Doc. Yeah. Knock on wood. I'm sure they need you there.
Well, yeah.
But just approaching 2 years into the pandemic, you seem a lot more optimistic, and you've shared that you think this could be a potential for that herd immunity. What's your advice, just as a physician, to people in general? I know. We didn't talk about it, but even people who've had COVID before can get the Omicron variant. That's being seen. So what's your message to people at this point?
Well, this time I'm being more optimistic. My message is don't be scared. COVID is here to stay. It's not going anywhere. We hope that this variant will be the beginning of the end. That's what we want. We want this to put a nice closure to this episode in our lives, but common sense. Use common sense. Avoid large gatherings. There is no question about that, especially now with this very rapidly contagious illness. Keep your immune system strong. Keep your chronic health conditions controlled, and more importantly, vaccinate. Because that provides you with some degree of resistance to at least make sure you don't end up in the intensive care unit.
Yeah. All right, Dr. Varron, it's a pleasure having you. We're so grateful
you so
had the time to share with us what you are seeing with the Omicron variant. You continue to stay safe and take care.
And hopefully I won't see you guys next year unless I go there for vacation.
You need vitamin D, so come on
Come
down.
to Belize, yeah.
I know. Excellent.
All right,
Good
take
idea.
care.
Bye-bye.
All right, we're about to take a break though, but when we come back, we'll be chit-chatting with a mom, and she'll be sharing with us her tough journey of battling leukemia. Within that battle, she had an angel of a caretaker. That angel will be joining us as well. So stay with us. We'll be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor, and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
The ministry is collaborating with SpeedNet Communications to have a vaccination campaign for children ages 12 to 17 years. Children who get vaccinated will get a chance to win fabulous prizes, including backpacks with supplies, Nintendo Switch, tablets, book tuitions, and MiFi with 3 months data. Only children 12 to 17 years old can participate in this Smart and Ministry of Health and Wellness raffle. At vaccination sites, each vaccinated child, upon being vaccinated, will receive a ticket to place their name, age, date of birth, BHIS number, and contact information on, which will be filled out by a parent or legal guardian. The sooner a person vaccinates, the more chances he or she will have to win. Get vaccinated, Belize. Vaccination saves lives.
Morning, B.
Ready for full leg box?
Yes, man. Just grab the rope and I will put on the camera. My name is Josh Marin. I'm a commercial fisherman out of San Pedro, and I've been fishing my whole life. We've been noticing that each and every time we go out, we have to find further grounds. So when I heard about the program, I found it as a very good business opportunity. Other fishermen, when they go out, they tend to bring in everything and anything, and that's what me and my crew don't do. We practice responsible fishing.
Just show me how the app work, G.
Easy thing, bro. All we gotta do is we're gonna put in how much fish we catch right here. So then we get 15 pounds of champagne and 30 pounds of queens. We have punch that in, and that's all. Oh, one more thing.
2021 was filled with highs and lows. A second year of pandemic life with vaccinations and variants. More tragic deaths due to crime, multiple protests, political drama, environmental milestones, and Belizeans excelling. Before we ring in 2022, we'll take you back to some of the biggest stories of the past 12 months. Join our news team on New Year's Eve for News 5's Year in Review. From headline stories, historical moments, and even the most buzzed about topics on our social media, we'll give you a complete rundown as the year comes to a close. Make News 5's 2021 in Review a part of your New Year's celebration. Tune in on December 31st at 8 p.m. right here on Channel 5 and streaming live on Facebook and YouTube.
Welcome back to Open Your Eyes, and we're moving now into our second segment for the morning. Now this one we'll be having a conversation with none other than Maria Jimenez. Maria Jimenez is she is actually a leukemia patient, and she'll be telling us all about that. Now, welcome Maria, and of course her angel caretaker is actually here with her, and she's none other than Naomi Ferguson. Good morning.
Good morning.
And how are you?
I'm fine.
How old are you?
13.
Oh my goodness. Maria, let's talk about your story. You battled leukemia. Tell us how did this all start?
When I was working one day, I told myself, I was working at Darrell's at the moment, so I used to tell myself, I don't feel right.
Yeah.
Something wrong, and I used to sleep a lot when I reach home. And my friends used to come and heal me, and I don't want to go nowhere.
Yeah.
And I tell myself, I'm going to go do a checkup. This time not me. Sleep home, stay home. And I say, I know something. I tell my supervisor the day, and I said, I need to take the morning off and go to the doctor. So she's like, really? I tell her, it's kind of feel right. So it's okay, then go. In 2017, I found out really what's wrong with me. And I was stressed and never want to tell nobody. Mama asked me what happened to me. I tell her nothing, ma. My kids, they ask me, tell her nothing. So they're like, okay, then nothing. Mommy, will you lose weight? She was big. What happened? So I don't know.
Why didn't you want to tell anybody?
Because really, I don't want to worry about me then. Because they made me go to school. And they were smart in class. So I don't want to stress them at school. I want it for me okay. You know, and I keep it to myself. And 2019, I tell myself, okay, I find someone and me and he battle it out. Move her from Belize and put her in the village school. Was nice and everything. Then she noticed, Mommy, can't get up out of the bed now. She said, Mommy, what happened? You can't get up. I said, no, I need somebody for help. She said, Mommy, you know, I got a doctor. I got a doctor so much time. And they're like, you need to do more tests and things. I'm like, okay, then no problem. So I said, I don't want to tell her nothing because she's smart in school. So one day she said, Mommy, I need to go. I tell her, I want to bathe. So she said, all right then, I'm going to bathe you, Mommy. Never know the sun was really hot the afternoon, and all of a sudden in the bathroom I just collapsed. When I collapsed, she like, Ma, and I don't know what happened in the morning, the afternoon. So I said, are you to cry for Naomi? She like, you faint upon me, Mommy. I can't go bathe you. Put on back your clothes. Let's go upstairs. This is what she told me, no, right? So I like, all right then. But I said, I have to bathe. I can't go walk. I have to bathe, baby. So I said, all right, I'll bathe you. She get the big tub full of water, carry it upstairs. I'm like, you bathe me for true? Say, yes, I'll bathe you for true, but I don't sure for bathe you. So I like, okay, then no problem then. So she bathed me, put me back, change my clothes. I said, watching my own clothes, you know, I will do that. You just sit down on the bed and then I will attend to you. So she one day, I said, night, school bus they come, you need to go to school. She said like, you serious, Mommy? I know I go to school. I will take care of you. You sure? I said, yes, Mommy, sure. I will take care of you. And since then, she was on my side. The girls, the oldest child, she want to finish her school. And look like she started to get stressed. So she's like, Mommy, I need to quit.
Stop school too.
She stopped school. So beside that, everybody stopped. The three of them stopped and started to take care of me. Anyways, I said, okay then. Mama find out more that I can move for myself, and she take all the pressure on herself. So she like, Maria, you need to come back to Belize, right? So I said, okay then, Ma, I'll come to Belize. In November 2019, I end up the hospital like at least 7 days. Coming out from hospital, I end up the Ladyville with my mommy, and from then, I get to know a lot of people. I get to know people's like, nah, who the people they, where they come from. Me no know, ma. I don't know, mommy. She like, well, I don't know neither, ma. So now, when I find out, my mama come to me and my mama say, Maria, I talked to a man, my name is Mr. Albert. So I said, well, I don't know who that is, Mr. Albert. So he said, he's supposed to come and talk to you soon. So I like, all right, then no problem. When I find out, we was in a, how to call it? How to call the place again, Mama? Poverty home. And Mr. Albert actually come help us. And when they come and help us, we get a better place, better life. And from then till now, people help we, and I appreciate it, because another time I actually made it give up. Like say, I can't handle it no more. And I look at myself, I used to look at myself in the mirror, like, I can't do nothing for myself. If I want to turn on one side, I have to ask my little niece or my little nephews, therefore help me, turn me from another side, lift me up, or for make I sit up. So they're like, Auntie, you don't know this, Auntie. Auntie, why you not get up off the bed? And I'm like, because I'm really no more get up. Sometimes I feel frustrated. And really, and then for come back, it was the way how I come back, be real. Couple months before my oldest child, she said, Mommy, you need to get out of the bed. You struggle. You don't know like this. He said, I have something to tell you, Ma. I said, what happened, babe? Oh, yeah, I'm your granddaughter. I said, I don't know, babes. In August, I tell myself, early August right here, I tell myself, I will go and be a baby. I need to get up. I need to take care of my baby. No, this is what they said. From then till now, that's her. She's beautiful. And she
That was your inspiration?
Yes, that was.
To have this photo?
Yes. That was Christmas Eve day when we take that picture. And I said, Mommy, they asked for pictures right now. Yes. I said, her name is Royalty.
Royalty.
Wow. Yes.
But Maria, I mean, this is kind of the short version, I know. But when you got so sick that the children had to stay home and help you, you had not told them you were sick because you wanted them to stay in school.
Yes, I did.
It must have been so hard when it reached a point that they had to do exactly what you didn't want them to do to help you stay alive at home.
Yes, Mom.
What was that like for you as a mom?
It really rough. It really rough because I know that I was a person like really independent woman.
Yeah.
You understand? And then they don't like see me like that. So they're like, and now I could say I'm happy with part of it because she gone back to school. Even though she have a child right now, she's back in school, Fort Farm. And yes, that's her. And she's doing very well. Naomi's doing right too. She's doing right. But she stayed back a lot because she was the main one that was really taking care of me right now. So right now she's in standard 4. She's doing good. She's doing very good. Very, very good.
So and you speak of Mr. Albert, we know him from Ladyville Highlights.
Yes.
We've had him on the show many times.
Yes, I
They
know.
have an amazing story where they're trying to help people from their own
Yes.
community by bringing it to people's attention and helping to get support. But what was it like? I mean, when the story was first shared? Because being sick is difficult, you know. Having a child take care of you, it's not what you wanted. It's what happened, but it's not what you wanted. And then it becomes public knowledge. What was that like in the beginning?
Man, I don't know if it's about one day real. I used to, what people would say, what people would think. This is what I used to say, what people would think about Maria. I don't like, when people, usually when I used to get visit, I used to have people, I used to go to St. Joseph Primary School. And the teachers used to come and visit me.
Yeah.
I used to have 2 students come and visit me too. There was great, amazing.
Yeah.
I heard, I don't know if you want to call a name, but
yes, of course.
Yeah, man. These are the people who, you know.
We like big ups.
Fernando is one, and Vanessa. They came and they were
your old classmates?
Yes, they was old classmates. And Vanessa, I'm like, I don't remember. Well, Vanessa, I remember Vanessa. So I told Vanessa, like, who is that guy? He said, you don't remember he? I told him, no, I don't remember he. He said, remember Spanish boy Fernando? I'm like, really?
Fernando, that.
That Fernando. They look like, you know, when you know somebody from child, they come up together and they get adult. They're doing, you don't remember their face. I'm like, don't remember Fernando. Why I mean, no. I'm like, really, Fernando? Then she said, yes, I mean Maria, I meet this. I'm like, all right, then, cool. It's nice to meet people. It's real. Because you don't know people from nowhere.
But Mar, you were loved. You are loved, and that's the reason why. I want to get to Nai. You know.
Sure, no problem.
Nai, how old are you again?
I'm 13.
13. Wow. Nai, tell us about your mommy. What kind of person is your mommy?
Nice,
No?
kind, loving, and caring.
Yeah. You cook nice too?
Yes, sir.
Now you're back in school, right? What school are you going to?
Ladyville RC.
Okay. And you started back again this year, right?
Yes, ma'am.
How long were you out? About how long?
A year.
A year.
1 year.
Okay. What was it like for you?
Yeah.
Not really good, but not a choice to make. I had to do it for my mom.
Yeah. Wow.
And what kind? And you know, mommy said what? That you didn't give her a choice. You tell her you're going to help no matter what.
Yes, mom.
Yeah. And when you started to get people come and help by providing stuff and helping with the health care, and look at her now, she's so healthy. What's that like for you?
Good. Amazing.
Oh, so cool. and Mar, you know, I read over everything that was sent to us, and it did say that you were bedridden for a while. You couldn't move. You couldn't do a lot of stuff.
Yes.
Tell us about that ordeal and what pushed you over the hump to get out of that bed.
When get out, because people used to like, Mar, you need to get out. You have to come out of the bed is suck you in.
Yeah.
So like, sometimes I'll come out of it. I try. I remember one day I really want to take a real shower, and she helped me. She said, Mommy, I will bathe you today no matter what. I said, you serious? I said, yes. And she bathed me. She put me back in the bed. People come, and I tell Naomi, I don't want to see too much people. I like, really? I think one time one of the guys called me already, and I may really shut on the guys down because I said, I don't really want the, I don't go and treat already, I don't want to go treat again. So I just want to be calm, just calm.
Yeah.
And the reason why I really make up my mind and tell me I have to get out of this better, because I used to see my little niece and my nephew, they come, they jump up on my bed, auntie this, auntie that. And I tell them, come out of my room, I want to by myself. And then I left me, so I was like, okay, then I have to get out. I still have my wheelchair. And I still have my walking stick. Then one day I remember I got in on the wheelchair and then I may have to go in the hospital. It's the day in August. I don't remember the day correctly.
It's August that just passed.
Yes. And my daughter, that one right there, that was the first time I get up off the bed.
Oh my gosh.
Off the bed. And she said, I was getting ready to go to the doctor. And she said, Mommy, how you feel? I said, I feel good. He said, Mommy, you will get there. You just have to have faith.
Yeah.
That was she tell me. And from then till now, I get back on my foot. Because of my kids. My kids give me the courage to get back on my feet. And Michael's my grandbaby too.
Yeah.
Because now I take care of them.
Oh, wow.
They don't have to worry about get up and make breakfast for me anymore.
You could do your own thing.
I could do my own thing.
I mean, if you just look at the difference as to what that was, what state you were then and what you are now, look at you. It's amazing to see. You know, being sick is something that is difficult for people in general.
It's something like, how is it? Like poison, something where they kill you inside and you try to fight it to get back. I may feel something like that. And and I remember the first time when I walked after that video there, one day my nephew come, Auntie, I know why you drop, Auntie. I said, Ty, Auntie, I know I drop. Right? He said, but I have to hold you at the bathroom. I'm going. But I have to hold on to the walls to reach the bathroom. So he come to my waist and hold me up. I said, I know why you drop, Auntie. I can hold you. So my daughter come out and said, please leave Mommy alone. Mommy, I do it by my own.
Yeah.
And you know what he do? He stand up right at the bathroom door. Just for see if I would drop. I said, son, I'm not drop. You could close the door and I need to use the bathroom now. So he said, okay then, Auntie, I will close the door. I said, all right then, no problem. Thank you. He said, Auntie, you need help? I said, no, I don't need no help. I'm good. When I made that upon Ben, they used to make her laugh. They used to make her cry sometimes, but the laughing make it joyful, right? So like, Ma, I get tired now. Am I tired now? You're tired you get up? I'm like, all right then, bitch, I try. He said, man, I'll be real, I'm tired. She used to tell me about it. Sometimes when she tend to me that the mommy, you are the baby. I did tend to you. I'm like, you really? And up to now, she treat me like I'd have heard that. So I'm like, all right then, man, no problem.
Oh man.
So it's like sometime you come to me and say, Mom, give Mommy a kiss. Give Mommy a kiss. He said, Mom, I don't the mommy, you just my baby. He said, no, I still her mommy. I said, okay, you name Maria and Naomi then. But we have fun together. And be real, I pray a lot. I do pray a lot. Praying, I think the praying make and be real, my boss did came to me in my dreams. He came to me and he said, Mar, let's go with me. I said, where? He said, just let's go. I said, no, I'm not going. And I closed back the door and I wake up. So when I wake up, I was like, no man, he done pass away. Why he come to me for? I was like, really? And I tell the kids the next day, I say, Mommy, well, their boss me, why you go with her for real? I was like, no, I don't want to go. I'm not ready for go. I tell her already, I'm fine. Since then, I say, I have to fight it. I have to fight it. And from then to now, I think the other day she asked me, say, Mommy, or last night, he said, Mommy, your boss not come back to you, no, John? I tell her, no. Why? He said, because he, why you go? But it's amazing. It's amazing. My kids, they're loving. My son, one day I remember with the girls me forgot do their hair or something. So Rosanne tell her, Elton, you for stay home and tend to Mommy. Say, if Mommy do, you will have to change her. He said, who? He said, you make sure you do all of them there before Rosanne and Naomi go. So he like, I not attend to you. I really not attend to you. I said, Elton, you serious? He said, yes, ma'am. I'll if you right there to Rosanne and Naomi come. I said, oh my God, you're terrible. I tell her, but he make a laugh. Lately, I remember the other day, he come to me, he said, Mommy, you gain a lot of weight. I wonder if I could still back you. So he try back me, right? So I said, boy, I make a drop. So he was like, no, babe, I don't make a drop, man. I make because he like, call me babes too, right? So I don't make a drop, babes. I don't make a drop. You think I make a drop? Well, I tell her, I know why you back me. Please put me down. Like that, I tell her. But so far.
How long ago was this picture?
I think in last year.
That was last year?
Yes, that was last year.
Naomi is saying no.
When was that, Naomi?
When was that?
I don't remember, but the last year.
The last year?
And this year?
Or this
Yes,
year?
yes.
This year?
Yeah.
Yeah, I thought, because I think so, yes.
Yeah.
I was still, I really like the picture.
And you what?
I really like the picture.
You don't like the picture? No, I could imagine. And we don't have to keep it up for long because I don't want you to feel, you know, I think just being able to have this conversation with you now is a blessing.
Yes.
Your story, Ladyville highlights and Albert and his wife.
Yes.
It was a story I think that captured everyone's attention.
Yeah.
Yes, that's right.
People were concerned about you. People were concerned about Naomi. People felt the need to reach out and help. And that's what I want to hear about. You know, when you saw you were alone in the struggle for a while.
Yes.
Until you became bedridden, and then the children were helping you and your mom was helping you. But when it became a public story, brought to light by Ladyville Highlights, you saw people from all over come to your house and step in to be that assistance that you needed. Tell me what that was like.
Yeah.
Well, that was good. It feels good.
Yeah.
Because you know that people, they watch and people hear about you. And people used to call our part of the nights.
Yeah.
Her phone, especially her phone.
Yeah, because she got a phone with
Yes.
her. That was one of the first because she didn't have a way to communicate.
Yes.
Yeah.
But I remember one day Mr. Albert come and Mr. Albert said, so if anything happened to you, how they will contact or call ambulance or something for help you or something like that. So, well, we don't have nobody for call. We don't have a phone. And he said, okay, then we'll get one phone on. So I said, her, she get her phone. And I'm like, all right, then no problem. And from then to now, she still have her phone. And that moments that I'm happy, nothing really me wrong. When people start to come wrong, fathers come, people come, they talk to you. People talk to you, people, well, I never know people really see this thing up and highlights. I was like, okay, people come, people talk and pray for you. And I understand people come from and they don't like you like this. So I'm like, I tell myself, you know something, I happy enough the day part I did because I really happy because my kids them they struggle a lot with me then. And how to say it, I have some guilt because my baby belongs in high school right now. But she's doing very good and to everything I know say okay then I would have happy still that she's back in school because that was my priority for get her back in school.
Yeah.
And get back myself for be myself enough the day because I want to get back on my foot because I tell them I need to go back to work. I need to bring back food in the house. With my oldest child, I say, you don't need to go through all of that, ma. I tell her I don't used to it. I used to be independent, being and bring things for them. When birthdays, they could tell you about birthdays. I go all out for them.
Yeah.
They know that even if I have to get it for myself or borrow it and pay for it, I would do for my kids then. And my kids, they know about it. And for love them, I love them more than anything else because they give me the strength to get back on my foot.
Yeah.
They pray with me, they cry, I cry. When they laugh, I laugh. So that is a joyful right there.
Of course.
And when we eat, they eat.
Yeah.
If they eat, I eat. If we know nobody not have nothing at the house, nobody can eat. And I remember those days. And when I tell myself, I
Do you
remember.
think that was a part of it, that you couldn't work and provide for the family and it was weighing on you?
Yes. That
Like everything you didn't want, you couldn't provide. The kids were out of school.
Yes, and
you're sick and can't do anything about it.
And all of that been run through my head, and so far, right now I don't have to worry about it, but I always tell the kids, I walk back to work.
Yeah.
I need to work back. I need to get back on my foot. I have a baby for 10 to now, so, and really, I don't want to stay home for say like, stay home, just not do nothing, just up on phone or just watch TV.
Yeah.
I want to do something. That's why sometimes I stay home. If I do home, I clean. And then they pick me there. My, every minute you clean the house.
Yeah.
I said, I love my house clean. You are never known somebody will pop in at your house.
Yeah.
And see your house dirty. So one day she said, Ma, when I get my own house, you will take care of me. Come clean my house. I said, no, Mom. I don't do much for Una, and I think I need to clean my house for Una, so no better find somebody else to clean that house for Una.
Yeah.
The Ministry of Health relocated you to a new home?
Yes.
Okay.
They did.
You're still there?
We're still there.
Okay.
Right now they're helping us with the rent and the bills, so because I'm not working. So
You're still getting treatment?
Yes, I'm still getting treatment. So right now, they don't want I. Really and truly, my kids don't want I work, but I want work.
You want to work.
I don't used to work. I can't stay home.
Or
I stay home almost 2 years in bed, so I'm like, I need to get back out.
Are you
But
strong
were
enough?
sick. Let me check
Yeah,
with Naomi
sure.
for a second. Naomi, you started back school. How is it going?
Good, I have a good teacher.
You have a good, tell us about her.
the
There are
teacher,
lots
yes.
of good teachers out there. Tell us about her.
She is nice. She is kind. She is funny.
What's her name?
Mrs. Rodriguez.
Mrs. Rodriguez,
Okay.
all right. You had a lot to catch up on after being out?
Yes, Mom.
And how did you feel when you went back?
Good,
Like having to
because
get to work again and
my sister used to go and collect my packages
okay.
so I can do my schoolwork.
Okay.
And my teacher is a very understanding person.
That is so sweet. to
God,
hear.
I know.
Marie, you know, your story, I think, is something that we will, it's our positive story to close the year. We just wanted to show that there are good things happening in this country.
Yes.
And you know what? I think you went through something, maybe not all parents go through it as severely. They may not be sick, but sometimes people need help.
Yes.
And they don't know how to ask for it. And they're scared of what people will think
Say or
if
say.
if they say, I need help.
Yes.
For any mom at home, any single parent at home who is struggling and is feeling the way you felt when you were in that bed, what would you say to them about reaching out and asking for help?
Just ask for help. No shame, no be shy, like how I did. Because I was shy to really ask for help. And I think that for me, from since I know myself, and I like ask nobody for nothing. And be real, feel good for lock up, open up, be yourself. If somebody will help you, they will help you with their clean heart. So I would say, just be yourself. If you need help, no wait till last minute, like what I did. You understand? No wait till last minute. So I just ask whoever need help out there, open up themselves, be their self, and always ask. If they say no, means no. Not because the person say no, somebody else will say no. You never know what happened.
Did you ever think that there were so many people out there willing to help?
At the moment, no, Mom. No, Mom. One spell I give up. She came to me and said, Mommy, you can't give up. You need to. That is when I really came out of the hospital, and she really have to did it for me. And you have to stay. I know why you go, Mommy.
Yeah.
We used to play cards. We play games. Sometimes only me and she in the house. We play together. We laugh together. We cry together.
Yeah.
So we used to have fun together.
Yeah.
She done my eyeball.
Yeah. Everybody know now.
She done my eyeball. This is my baby, and then the next one.
And all your kids can learn in the home.
Yes, I know.
It makes them get jealous. I come from a big family, I know. But, you know, I want to say this, that what I see and what I hear from you is that you're a strong mother.
Yes, I do.
And when things got hard, it was hard to ask for help.
Yes.
And someone stepped in to bring light to the situation, and people responded.
Yes.
But what you did in accepting help and allowing people to know your situation was the strongest thing you've ever done. And I hope that's a lesson that your children learn, because sometimes you do have to ask for help if you need it.
Yes, ma'am.
Yeah.
I know. I could say what we did now. We live good.
Nice.
Nice. I think they got more life, better life than how I used to live when I'm younger right now.
I mean, Maria, if somebody showed me that picture, well, I saw the picture, I saw the stuff on the page. If I had seen you, I would never know it's the same person.
Yeah,
it is
you look totally
amazing to
different.
see. What are the doctors saying now?
No. Well, really, there's just no want to gain more weight because I was bigger.
Okay.
So right now I gain like 139 pounds. So the doctor tell me I can't gain and I can't lose. Just make I keep it to 135. If I could, I would have to exercise a lot.
Yeah.
Eat more veggies. So for be healthy, I have to do more of those things.
Yeah.
And the leukemia?
Well, that is okay. So I don't have to really worry. I just do the right stuff. No more drinking.
So just keep a balanced diet. So
Yes,
you don't,
just
yes.
keep it under medication.
And what are you doing to make sure that you keep stable like that?
Well, eat the right thing.
Mhm.
That's all to it. Be yourself. I know how I used to be when in the past, but now I have to leave those things and just be me. Christmas gone, no kind of rum, no beer, just sodas.
You had ham?
Nope.
Health dressed up the devil, right? If you have to eat healthy, you eat healthy.
I be real, no, we don't, because her dad doesn't eat those stuff.
Okay.
So we cannot buy it in the house. So like last night, I think my oldest child, hello, mommy, I want to eat pigtail. He said, you better go find a new pot and try to cook that in a different pot for me. And so he told her last day, so I was like, Daddy, really? Say yes, really. Yes. For that part, helped me to forget up.
Yeah.
Get back on my feet. I'm happy for that because I think because if I never think of my kids and their father, I don't know what happened to me.
Yeah.
And I remember one day he put me outside in the yard and he said, no slippers, you can bare feet. How when I feel the grass start joke up my foot, he said, you need some of the nail in your foot. I said, I don't need no more. I need to get up. Please bring me slippers. That time I used to use the how you call it, slippers, home crack, some big ugly one there. And I'm sorry to use the word. Crocs. I really have to use the as I put it on. And so I start walk. For get back up, it's a rough road because right now I have a problem with my right foot. When I walk up, some like for a step or a bus, it's really rough because it hurts. Sometimes I use the left foot most of the time for lift myself up. And I noticed today when I get off of the bus this morning, I use my right foot. I feel my foot just, I'm like, all right, then I have to slow it down a little bit.
And it's partly because you were in bed for so long.
Yes, so like really have to exercise. I tell my daughter, this my heart, catch taxi. So you don't need to take no taxi. Right, that smart, turn the bend. I said, my dad, a lot of walking. I wonder if I will remember how to find this area. So we walk, she get tired. So I said, you know something? Really?
Well, look how far you've come.
Yeah, look how far you've come.
Look how far you've come, Maria, Naomi. It's so wonderful to see you. It's so wonderful to see you in a better state.
Yeah.
Yes,
and we appreciate you coming in and sharing your story with us.
Yeah,
Thank you guys
Alright.
so very
Yes,
much.
Mom.
Mom is strong enough, right?
Yes, sir.
There you go.
All right.
Thank you
cook
guys
for
for joining
them.
us.
I cook for them a lot. So.
All right.
They're
Good.
strong. All right.
Guys.
We're going to take that break. And when we come back, of course, we'll be talking to you about tips for protecting your dog from the traumatic sounds of fireworks and dynamite. You don't want to traumatize them. We'll be telling you about those tips when we come back. Stay with us.
Hello, friends. This is Dr. Bob Roberts with another 60-second sermon from God's Word. The Bible says it was by faith that Abel brought a more acceptable offering to God than Cain did. Abel's offering gave evidence that he was a righteous man, and God showed His approval of his gifts. Although Abel is long dead, he still speaks to us by his example of faith. There's an old proverb that says, "Dead men don't talk," but there is insurmountable evidence to prove that they do. Martin Luther King, John F. Kennedy, and others have long been dead, but they continue to speak to us through their books, their recordings, and the lives that they live. The British jurist Erskine was famous for his eloquence and persuasiveness, yet on one occasion as he tried to speak, he only stammered and hesitated and faltered, and he dropped his head. The court was crowded with spectators who said in their hearts, "Erskine has failed." Then a new glow came into his face, and a new inspiration possessed him. He then lifted the people out of their seats with one of the greatest closing presentations his generation had ever heard. When he had finished, the judge left the bench, put his arms around him, and said, "Erskine, you have won." The people asked how he did it. He said, "As I hesitated, I seemed to hear my mother leaning over the jasper wall saying, 'Speak, Erskine, speak.' I heard my wife, my children, and my father speak. When I realized those who are depending upon me were calling me, it gave me a new inspiration. So in your times of despair, listen closely, and you will hear your fathers and your mothers and your heroes of faith speak, because dead men do talk." Today's 60-second sermon has been presented by Christian Foundations of Faith in cooperation with the Baptist churches in your area.
It's a fact that your credit lasts longer when using Smart. During these times, we're all trying to find ways to cut costs and save the little resources we have. With Smart, it's easy to do that. It's a fact that with Smart, your credit lasts longer. You can call Smart to Smart and Smart to Digi using your promo credit, while with the other guy, you can only call OnNet, Digi, or BTL numbers. What does this mean? You get to call any national number using your promo credit. Your promo credit is free, so that call is also free. Know your facts. Don't be tricked by the other guy. Be smart and save your dollars.
It's holiday season 2050, and the hottest trend is microplastics. For over a century, our ancestors have neglected the oceans. As a result, every food cycle on land and sea has been saturated with microplastics. And at Plastico, your trusted source for great meals, we pride ourselves on providing only the best in microplastics.
Just like Mom used to make it.
Wasn't your Plastico turkey delicious?
So tender.
It goes great with plastic soda.
You heard it, folks. Plastico turkey, your best and only option this Christmas.
We eat what we throw away. It all goes back into the oceans and then back to us as microplastics in everything we eat. Call for a strong single-use plastic ban in Belize. Our future depends on it.
Imagine going through your entire day without the burden and risk of carrying cash on you. Belize's shift to digital wallets has begun with eCash. We can now skip the cash when collecting money or paying for our essentials, all while using a fast, easy, and secure platform. Simply add funds to your wallet via bank transfer or at an agent, and you're good to go. You will be able to make quick, easy payments simply by scanning QR codes. And best of all, it all happens just like that. Payments are as easy as clicking a link online or scanning a QR code. Download the eCash app from the Google Play and Apple App Store today and take your first step into a cashless lifestyle. The future is here with eCash. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257 to find out more.
2021 was filled with highs and lows. A second year of pandemic life with vaccination.
And welcome back to Open Your Eyes, and we're moving now into our third and final segment for the morning. This conversation is going to be about how to protect your animal from, all the dynamite and fireworks, because we'll be celebrating a new year, and that's one of the ways that we celebrate. Now we've got reps in from Animal Community Rescue. I think
Community
that's it.
Animal Rescue.
I'll mix it up.
Belize
That's a hum with the hammer, all right? Luz Hunter is in with us. Renee Wentz is in with us, and they'll be telling us what not to do to scare your animal and traumatize them. Good morning to both of you.
Let's say welcome, fellow animal lovers, right?
Oh,
I think that's a shared community
Look
here.
at
This is one of the topics that we hear about, but we don't talk about very often.
Yeah.
And before we get talking about fireworks and dynamite and whatnot, because that'll get you heated, right?
Mhm.
Let's just talk about the work that you've been doing with Community Animal Rescue.
Yeah.
Well, I think that there's a whole community of animal rescuers, and it's not really organized.
It's just a Facebook group.
We are a Facebook group,
Mhm.
and we are just people that love to help animals,
Yeah.
and we find them on the streets, and we foster them,
Mhm.
and we look for people that want to own them. And I used to be a part of the Humane Society that is kind of not really, again, too organized anymore. But you don't have to. I think the thing with the Community Animal Rescue, right, Lutz? You don't have to be organized. You can just be a person.
Yes, and every day you get new additions to the Community Animal Rescue group, and if you would log on and look at it, you'll see. It's mainly people, because there's two kind of people out there, right? Those that will not be able to walk past an animal in distress, and those that will look at it and laugh and just keep going. And but there's a lot of people that as individuals, they will do as much as they can. I personally know at least two or three dozen people that you talk to them, they love animals, and they say, oh, all my dogs are rescued. How many you have? Oh, about 7, 8,
Yeah.
It's just that these animals walk into their lives and they're just not prepared to walk past them, and they take them home. Some of them are in horrible conditions, and then you get them to where they look beautiful. But it's very hard to get people to adopt. Everybody wants the breeds. And the fancier and farther away they come from, and the more they cost, the more they want them. I guess it's like cars, no?
Yeah.
Nobody wants the old broke-up car, even if the broke-up car could carry them and bring them back, right?
They want the fancy one.
They want the fancy. So because of that, we end up with literally hundreds of dogs on the street. And I'm saying easily, if we went around with a big 21 cubic foot truck, we could fill up that truck with
one day.
In one day, easy. Just around Belize City.
Just to Belize City, I was just about to say.
Yeah.
There's people out there that feed dogs every single day that are street dogs. There was a time that never exists, because I'm 65 now, and I'm putting it on TV. Yes, I'm 65. But what I'm saying is that I've been here for 65 years, and all my life growing up, from 7, I remember getting a puppy that walked in. You did that in those days. You find a lead dog, you carry it home, you take care of it. Nobody had breeds. I don't remember anybody. I think the first person I remember having a German Shepherd, I was like, wow, that's a strange looking dog. It didn't look right.
Because we only had pot lickers.
We only have pot lickers, and everybody wanted one. And you wanted a dog that was cute, and it was cute. Now that has changed.
Yeah.
And it's bad because now dogs are out there.
Yes.
And
for years, and you know, I think most people here know I love dogs.
Yes.
And
Dog lover, right now.
I know. But for years, we've been talking with different groups that try to help with the state of domestic animals in our country. Way back when there was still a Belize City Animal Shelter, we did a feature. We went there. I think it was Carolyn at the time that was running it. It was by the Belize City Council area. It eventually closed. There's no support for it. And unfortunately, when people know there's a shelter, they just go and dump their dogs there because they don't want to care for them anymore. Then we've had conversation as Humane Society, other aid groups, sensitization groups, and yet we still struggle with getting a proper control on the treatment of animals. That has to be frustrating.
Yes.
I have 2 cats that came from that shelter.
Wow.
Still, yeah. They're like
From the one that she was just talking about.
Yes, they're like 13 years old.
Yeah, it's like 12, 13 years ago.
They were babies when I got them, but I still have two cats from there. But yeah, you're exactly right. One of the problems with shelters is that they become a dumping ground. And that people don't do the right thing, which is the right thing is to spay and neuter always, every day, spay and neuter. And so they don't, they just let their animals go ahead and breed because there's a place you can dump the kittens and the puppies. And unfortunately that is what happens. You know, so and now we just have a stray population because we don't even have a dumping ground because we don't have a shelter. So the stray population is, you know, it's not even just strays. I mean, I have a thing I call owned strays, which is like the neighborhood I live in. There are a lot of dogs that they have owners, they have collars, but they don't have a place that they live. They run around the neighborhood.
They're allowed
bark,
to wander.
They breed. They do all kind of ridiculous things all around the neighborhood. And you know, but somebody owns them, but they don't care for them. And so I think you know, one of the biggest things is we need people that care for their pets. You know,
but let me say it because you're totally right, and I wanted to ask the question just before you made mention of it, of how to properly take care of your animal so you don't have strays, and that is to spay and neuter. But there are the folks who actually are looking at dogs now and say, it's a style. I want to put it in my purse, so I don't really worry about having to spay or neuter it. And then as soon as it grows older, you tend to just leave it behind. How do we deal with this?
Well, as we were discussing a little while ago, owning anything, whether you own a car, you own a house, whatever you own, and many people see having an animal as something that they own, right? It's not a companion, it's not a friend, it's not something you want to share the rest of its life with you. You're seeing it as a possession. Sometimes there's no real affection, but there comes a responsibility. I have seen people that they own a car and they own a dog. They spend more time washing, cleaning, and shining up that car than taking care of the dog.
Yeah.
Right?
You know, it's hard, and I know we've had people like Sergeant Hamilton come on to explain that there are laws against maltreatment of animals.
Yes.
Unfortunately, I don't know how seriously it's taken if I call a report and say my neighbor is beating or neglecting his or her dog. I don't know how often reports like those are made, but our laws do allow for them.
it's not enforced.
Yeah.
So
And the fine is minimal.
so yes, I
Yeah.
believe the fine is $10
I
or
think
something
the fine-
ridiculous like that.
And if they would-
$10?
No,
Yes.
I think it's 100. I can't remember.
No, it's not $100. It's like 10.
It's- And I think that would be a first step. If you can increase the penalties,
Yeah.
then there would be more emphasis on enforcement, because then, you know, government always looking for money. That would be they would make millions of dollars if they enforce the laws, because
Definitely.
lots of people are breaking those laws.
Yeah.
Even people that can afford not to.
Chaining up dogs,
Right.
leaving them in heat, not
Even
giving them
yes.
water, the abuse.
Yeah.
And I mean, this is right up your alley in
it's-
terms of talking about what this means when we have a society that is willing to hurt animals in this way.
Yeah, so I mean, we're talking about, or we're looking at, New Year's is coming up.
Yeah.
So we just passed Christmas, which we know is a big fireworks time, and we're coming on New Year's, which is going to be another fireworks time. So, you know, I find fireworks disturbing. Not fireworks, firecrackers.
Yeah.
Because there's a difference, right? Fireworks are something pretty we can look at in the sky,
It's
and usually
beautiful.
fireworks are not noisy.
And it's continuous for a while, you know?
Yeah.
And it's usually not very noisy.
It's not too noisy. Yeah.
Unless you're
Fire-
right next to where they're doing it.
Yes.
Yeah. So firecrackers, or as we've been known, like in the last couple of years, they're like dynamite. They're very loud. And it's just a boom for no reason. It scares me.
Yeah.
You know, yes, I am a middle-aged person, but
get you.
I imagine my neighbors are in their 80s. So I wonder, like, you're sleeping in your bed and you're elderly, and this big giant bang happens. What happens to you? I know across the street from my house is a baby. And every time that they set off these big noise, the baby screams and cries.
Oh.
Yeah.
You know, it hurts. It hurts their ears.
Yeah.
So,
Yeah.
So
when
if
you
that's
look-
how we're affected as humans.
so when you look at dogs have a hearing capacity that is so much more sensitive than human beings. So when that happens, they get very traumatized. You know, I have 6 dogs. Only one of my dogs is upset by fireworks. But I'm lucky in that way. A lot of other people, dogs are very upset.
Yeah.
Yeah.
And we find right now, if you go on Community Animal Rescue on Facebook, you're going to find a whole bunch of people
Complaining.
saying that their dogs are missing because
Oh
of
my
fireworks.
That's
God.
what I wanted to get at.
Well-
These are the risks that we don't think about.
Yes, and one of the things is whatever you do, anything that you do in life. I was telling Renee earlier, I said, I wish they would teach physics early in years, because in physics you learn that for every action,
There's a reaction.
there's either a positive or negative reaction. So
Reaction.
every single thing you do will have a consequence somehow. So you getting ready for New Year's Eve, you know what dress you're wearing, hairdresser you're going, this, that. Where is their thoughts about, what about the dog? Who is going to be looking after the dog?
Yeah.
You'll come home and, oh, my dog missing, right? Prepare, you know
Yeah.
what's going to happen, the dog doesn't know.
Yeah.
You know.
Yeah.
And as Renee said earlier, and you as a human know that it's going to end at some point.
Yeah.
The dog doesn't.
Doesn't know.
Yeah.
No. She mentioned something and I was going to tell her, there's so many dogs out there right now that have a hearing problem. You don't know until you see that dog walking down the middle of the highway and horns blowing at it and the
And
dog
it's not even moving.
respond.
That's true. That's
Right?
true.
So this is a good time for you to check your dog. If your dog has no kind of reaction to loud noises, it may have a hearing problem.
Yes.
But a dog, especially a younger dog that doesn't have any hearing problems, we have a range of hearing for us. And they're way outside of that in both directions.
Of course.
They can hear, and this is why sometimes you be at home and somebody's coming that they know, and they start jumping
They start-
around.
yeah, they
Long
start-
before we
yeah.
even
It's not
know.
that they have a sense that they're coming, you know. They hear and recognize the sound of
Their footsteps and all these things.
car, everything, long before you hear it. And then there's a range that we can hear, that they are way beyond that as well.
Yeah.
And that's the high pitch.
So when these
That's why sirens,
Yes.
loud motorcycles, even weed eaters, things like that, it literally hurts them. That's why they start howling, because they're in pain.
Yeah. Oh.
And we don't think about the effect on them. Not just the dogs, cats. Cats have even higher sense of hearing than dogs. So when they are hearing 10 times what we're hearing, the cats are hearing even more. Nobody
Yeah.
talks about the cats that escape. Oh, the cat got missing, it got missing.
Yeah.
Right?
But it's traumatized.
So
It's
if
traumatized.
if you have an animal that you are caring for, because that's really who we're talking. Ideally, we'd love for people to hear
We'd like
about the
everybody.
impact that they're having on animals, and really be more decisive about use of firecrackers and
Yes.
being more considerate.
Yeah, because some people don't think about it.
No, they don't. Even dog owners, they engage in
Yeah.
it. But if we think about somebody, let's say, you know, I'm going to leave my dog at home, what are some of the considerations I have to make? One, make sure they can't escape.
Yes, make sure that they're in a secure place.
Yes.
Secure. If you don't just leave them in the house and go, lock them in the bathroom or something that is secure, or in a kennel or somewhere. Look, even if you have to call your vet, discuss it with your vet.
Yeah.
You know, you can do things. Renee will explain right now what the thunder shirt is. You can wrap them so that they have more of a sense of security. But nothing beats you being there. Make your plan to be home. You know, if you really care for your animal, forget the party and this. You know there's going to be a risk for that dog. Stay home and take care of your pet.
Yeah.
Be there for them.
Yeah.
Nothing like
Because
them
it's
sitting right next to
traumatizing.
you, and they know when we have fireworks, they're surrounded by dogs and cats, because all of them, that they feel better, they feel more secure if you're right there.
You're
But
right
if you're
there
in a
with them.
house alone, I've heard stories about dogs that run right through a sliding glass door because
they're so scared.
They bolt. They not just run like running down the
Stop.
street. They take off because they think that the noise is just where they are.
Yeah.
They don't know that the noise is still out there or outside the fence. Or,
Yeah.
And when they get outside the fence and they're still hearing the noise, then they take off, but they don't know where they're going, and many of them don't find their way back.
Yeah.
They end up far away, or, you know, so.
So that's why we see so many missing dogs
Missing,
around this
yes.
time. Because they're running away because they're scared.
They're literally bolting, and then they find themselves someplace that is not familiar.
And they don't know how to get back.
And they don't know how to get back.
So this is definitely, this is a, you know, and I'm glad that you went to that, because some people are saying, you know what, oh, my dog gone missing, but it was caused
Yes.
for that animal to actually go missing.
Yes.
Yes.
Many times, especially right now, since.
So
and you
even
see
if they never usually go out, they would
Exactly.
run because they're
And
scared.
trust me, a dog that has never jumped a 6-foot fence, when
They'll
they
find
hear
a
one
way.
loud bang,
No,
they
no,
will
no.
find
That's
a
true.
way up through that fence.
Yeah.
That's true.
And
Yeah.
they will take off. And then
Right.
they can't get back in.
Right?
And you know, one of the best things, your presence, your personal presence with them is one of the most reassuring things. Just, you know, like I said, I have 6 dogs. I only have one that is upset by fireworks. And she's 13, 14 years old. I mean, she's old. So all she needs is just to be with me. So I bring her in my room, and she just lays down, and that's enough.
Yeah,
sense of
that's
security.
the security.
Yeah. But you know, if you some people have animals that are very noise sensitive, and so as Liz said, there's something called thunder shirt.
What is that?
And it is a way of wrapping a dog, like it's like swaddling. You know how we swaddle infants.
Yeah.
You know, when we have infants,
So they
we-
feel like they're being held.
Yes, we put them in a very tight wrap-in of like a blanket. It's the same kind of idea, and you can buy a thunder shirt if you want to spend, you know, $50 US on a thunder shirt, but you can actually make them yourself.
Okay.
And you can go on Facebook. Yeah, you could. That's a little too loose.
You want it tighter.
It's really wrapped around
Yeah.
the body, so it feel like
They're being
Like it's
held.
being
Give them a
held.
little bit of comfort and security.
There you go.
Yeah.
Like that. So you know, you can
I did that just
you
for the
can go on
pictures.
Facebook and you can find out how to make
How to
them.
make them.
Like
Yeah.
usually you just take an adult T-shirt
Mm-hmm.
that is like a very small kind of T-shirt and it fits very close, and then you can just adapt it. So there
Oh,
you
look
go.
at that. Oh.
Yeah.
So that helps. That helps to keep them
helps.
calm.
If they feel for some reason there's a security
Yeah.
that comes
It can
with
calm-
that
calm them down.
tightness, that just like again with babies. You know, we
Yeah.
do it to babies because they feel good to be wrapped up
Wrapped
tight.
up and they feel
So
held.
dogs feel the same way. So, but and like I said, you can do it. You don't have to spend money.
Yeah.
You can just go on YouTube and search homemade thunder shirt, and
You're
you
gonna
can
get
find
it.
exactly how to make one for your dog.
That's the
Yeah.
YouTube University, yeah.
Yeah.
But one of the things I get to, and this is primarily, especially for people who want to get a pet. First of all, you've got to prepare yourself for it. You've got to prepare your surrounding. You've got to make sure that you've got everything that you deem necessary for them. Because back in the day, when you get a dog, for security.